Atkins, moved by Senator Wolk. Do pass two appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, no. Pan.
Aye.
Pan, aye. Roth. Wolk. Wolk, aye.
Currently 4-1. We'll place that bill on call. We have the consent calendar, item number 1, 3, 7, 13, and 16. Is there a motion? Senator Wolk so moves. Call the members.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Monning. Aye. Monning, aye. Nielsen. Nielsen, aye. Pan. Aye. Pan, aye. Roth. Wolk. Aye. Wolk, aye.
Currently has 5. We'll place those bills on call. We're at now item number 12, AB 941 Wood Clinics Licensure and Regulation Exemptions. Good afternoon, Assembly Member.
Thank you, Senator, Mr. Chair and members. Before you is AB 941. The majority of California tribal health clinics are located in rural areas of the state. My rural district already faces significant challenges with access to health care and the challenges of the geographic nature of the district. I also have the assembly district with the single largest number of tribes in an assembly district. To deal with the challenges of access, tribal health clinics have opened new tribal clinics off the reservation to provide better access to care for their members and everyone else. The licensing process to open a tribal clinic on non-Indian land is duplicative, time-consuming, and costly, especially with the state facility license from the Department of Public Health. They are already licensed by the federal government on the same issue. The staff time and resources used in the duplicative application with the state could be better spent on providing for additional patient health care needs. AB 941 exempts tribal health clinics located off of tribal lands from the Department of Public Health's state licensed facility. These exempted tribal health clinics will still be required to comply with other state laws such as CalOSHA, the California Fire Code, the California Building Standards Code, seismic safety standards, patient and employee safety, California drug laws, and many, many more. Worker safety and protections are completely covered through compliance with existing state and federal laws. I would also like to add, we received today that the California Nurses Association has officially removed their opposition to this bill. We have received unanimous bipartisan support coming over to this House. Here to testify in support is Mark LeBeau, the Executive Director of the California Rural Indian Health Board.
Good afternoon. Please proceed.
Thank you, Chair, Vice Chair, and committee members. My name is Mark LeBeau, and I'm the Executive Director of the California Rural Indian Health Board. I want to thank you for allowing me to testify about the importance of Assemblymember Wood's legislation, AB 941. The California Rural Indian Health Board is a nonprofit and federal tribal organization that represents 30 tribes in their tribal clinics. Today, on behalf of CRIB, I respectfully request the committee support the bill. The California Primary Care Association, which represents over 1,000 clinics throughout the state, the Latino Coalition for a Healthy California, the California Pan-Ethnic Network, and multiple tribes and tribal clinics across the state request your support. The bill would create a much-needed single standard for clinic licensure for federal tribal clinics in California. Tribal clinics may only provide health care services within their federally designated service areas, which are primarily in rural, mountainous, and frontier regions of the state. Because there are no federal Indian Health Service facilities in the state, these tribal clinics provide services to American Indians and Alaska Natives on behalf of the federal government through federal contracts. Currently, tribal clinics located on federal Indian land are exempt from state licensure. This works well because all of the clinics must adhere to a comprehensive list of federal standards that ensure the quality of care and the safety of patients, facilities, and workers. For example, federal regulations require adoption of tribal health care building codes that are as strict or stricter than federal requirements. Those requirements are based on the Uniform Building Code. In California, the Federal Indian Health Service requires tribal clinics to comply with OSHPD 3 in order to receive facilities funding, and that's an essential financial resource for tribal operation. If a tribal clinic is located off federal Indian land, state licensing requirements apply unless they have a affiliation with an institution of higher learning, and then they can have an exemption. Despite the fact that the federal standards address all the same issues as the state standards, these multiple clinic licensing standards create undue administrative challenges, confusion, and burden for tribal clinics. This burden interferes with the mission of tribal clinics, which is providing healthcare services to American Indians, Alaska Natives, and other eligible patients within the federal service area. Once again, I humbly request that the committee support AB 941.
Thank you. Anyone else like to speak in support?
I just wanted to quickly list some of the tribes and clinics that are supporting this legislation. That includes the Big Valley Band of Pomo Indians, Chapati Indian Health Program, Cloverdale Rancheria, Feather River Tribal Health, Greenville Rancheria, Karuk Tribe, Lake County Tribal Health Consortium, Manchester Point Arena Band of Pomo Indians, Paula Band of Mission Indians, Pitt River Health Service, Redding Rancheria Tribal Health Center, Rosagini Rancheria, Riverside San Bernardino County Indian Health System, Santa Ynez Tribal Clinic, Sherwood Valley Band of Pomo Indians, Smith River Rancheria, Sonoma County Indian Health Project, Southern Indian Health Council, Toyabe Indian Health Project, Tule River Indian Health Center, 29 Palms Band of Mission Indians, United Indian Health Services, Warner Mountain Indian Health Clinic, and the Yurok Tribe.
Thank you. Anyone else in support?
Kimberly Chen with the California Pan-Ethnic Health Network in support.
Thank you.
Chair and members, Sean South on behalf of the California Primary Care Association in support.
Thank you. Anyone else in support? Any opposition to the measure? Questions? Comments? Yes, Senator Pan.
Thank you. And first of all, I just want to thank you, Assemblymember Woods, Dr. Woods, for bringing this up, and the sponsors as well. And I think that the issue you're trying to address is certainly a very real one, and one that will help improve access. So I want to be supportive. The issue I do want to bring up, though, is that, as I understand from the bill, basically a tribe can license a clinic outside. I mean, the bill basically allows a tribe to license a clinic outside, and would basically have to. They would, of course, be following federal standards that they would through the Indian Health Service and other provisions for the tribal clinic. That's where they get the licensing and the approval. And I do have a concern that the state is kind of left out of it. And I have no issues with the clinics that are within the tribal lands, because if someone who isn't a member of the tribe goes to that, that's tribal sovereignty to going there. When it's outside, there's much less clarity. And I appreciate actually that the tribes want their clinics not just to be available to their own members, but actually available to the community. That actually is helping the community. So that's a good thing. I like that to happen, right? But I also want to be sure that you're going to have clinics that the tribes are licensing, essentially, that are outside, and there may be some confusion as to who's responsible. Now, internally, we know it's going to be there's federal guidelines they have to follow, et cetera. But I just sort of feel like the state needs to be able to intervene if there's a problem. I don't think it'll be likely, but if there's an issue, a citizen of the state of California who goes to a clinic and there's a problem at the clinic, not just with the provider, the doctor, dentist, or nurse or whatever, but the clinic regs, because it's sort of getting around what I would say is that basically they don't have to be licensed through CDPH, and I understand why you're doing this, because the onerous part of it. So I'm hoping that perhaps you and the sponsors might consider the idea that, for example, perhaps the department to be sure the department still has authority to enforce their standards if there's a complaint or something that comes up that it's of concern. Again, it's to protect the public safety, ensure that we have clinics that meet the standards that we want to meet in the state of California, and to be sure that the citizens of California have a recourse if there's an issue that comes up. So I understand that you don't want to have to go through the whole application process, and it's been onerous and so forth, and you are going through a federal one where so it's not just like you can open any clinic. But I do think that if there's a problem that comes up that someone becomes aware of, that the state of California, that their only recourse is not just the federal government or the tribe, that they can turn to the state, which otherwise licenses every other clinic outside of military bases in the state, and would be able to get some sort of recourse. So perhaps can you address that particular issue and what your thoughts are, you or the sponsors, about that?
Sure, I'd be happy to. I appreciate the concern, and I too always have concerns about public safety.
Right.
I believe that there are mechanisms whereby there are opportunities for patients who are to have grievances and issues addressed. I don't. The reason for bringing the bill is not to circumvent state law. It's to circumvent a duplicative, expensive process that is essentially, in some ways, actually more comprehensive than what the state is requiring. Or what the federal government is requiring. So it is. I appreciate where you're coming from. I'm happy to continue the dialogue with you on that. I think it's important to note that while these are off clinic, these are off clinic, or these clinics are off tribal land, they're still within a federally designated area, and so there still is that nexus there, and that's we would not have brought this forward were it not for that. I mean, we're not going to. These are not clinics that are going to be showing up in downtown Los Angeles or it's just not the way it's going to be. These are very underserved areas. Every dollar counts. We're trying to maximize and create the best possible care for patients. And so I share your concern about public safety, and I'm happy to continue the dialogue with you.
I appreciate that, and I hope that, and again, what I'm looking for is, and I don't expect you're going to take anything up right now, but what I'm looking for, also look at the sponsors as well, is just being sure that CDPH, if there's a problem, is able to, has a role, so someone, that your only recourse isn't just, because normally people do turn to the state. That's who normally licenses clinics, that the only recourse isn't just the feds and or the tribe, that if that CDPH would have the authority to be able to address, and not saying that you therefore now have to send a separate application to the CDPH to get the clinic in the first place, but there's a problem. So that will help hopefully address the very reason for the bill, which is trying to get rid of the duplication and so forth. But clearly that if there's a problem, they have the ability to review documents and follow through on that. So appreciate you wanting to work on that. I hope we can try to get to a good place there. I'm happy to vote for the bill to allow this discussion to continue, but so I'll be happy to vote for the bill today, but I would like to see how this discussion goes in terms of future votes.
Okay, thank you.
Thank you.
Thank you. Any other comments from any of the members? Seeing none, there's a motion by Senator Wolk. I am supporting the measure. Would you like to close?
Just respectfully ask for your aye vote.
Thank you. We are at item number 12, AB 941, due pass to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Wolk. Wolk, aye.
Currently it's 5, enough to get out. We're going to place that bill on call. I believe Assemblyman Gray was going to, it's okay with, to allow him to go first. Come on up. We're going to go slightly out of order. Item number 14, AB 1130.
Good afternoon, Mr.
Good
Chair,
afternoon, Mr.
members.
Assembly Member.
AB 1130 would allow intermittent clinics to be open 30 hours per week, up from the current statutory limit of 20 hours. Members, this is a common sense solution to increase access for folks in vulnerable communities and underserved areas of the state. The analysis has recommended an amendment so that primary care clinics start reporting to the department when they are operating an intermittent clinic, and I'm happy at the chair's wish to take that as an author's amendment. The bill has no in opposition, received bipartisan and unanimous support in the first House, and I would respectfully ask for your aye vote.
Thank you. Anyone like to speak in support of the measure?
Hi, yes. Good afternoon, Chair and members. Thank you for the opportunity to testify in support of AB 1130. My name is Lisa Eisenberg. I'm the Senior Policy Analyst for the California School-Based Health Alliance, and we strongly support AB 1130. We advocate for and represent school-based health centers that operate in many of the school campuses throughout California, and we think many of them are operated as intermittent clinics, so this change would really help school-based health centers thrive and provide care to many of the students that we know have challenges seeking access to health care. So thank you.
Thank you. Anyone else like to speak in support?
Ben Avey with CPCA. We are in support.
Thank you.
Mark Engstrom, Central Valley Health Network, in strong support.
Thank you. Opposition? Questions? Oh, questions from the members? No? We have a motion by Senator Wolk. Seeing none, appreciate the amendments you're willing to take. My only question and concern was not knowing how many entities were out there that were going to be going through this process. If there was a significant amount that, we needed to find out, at least that we can start gathering that data. So I appreciate the amendment. I will be supporting the measure. And would you like to close?
Would respectfully ask for your aye vote.
Thank you. Item number 14, AB 1130, do pass as amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Monning. Monning, aye. Nielsen. Pan. Aye. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye. Nielsen, aye.
Currently at 6. It's enough to get out, but we're going to still place that bill on call. We have some members that are absent.
Thank you, Mr. Chair.
I believe now we're at item number 11, AB 775, Chew Reproductive Fact Act. And Assemblymember Burke. How are you? Good. Welcome, both of you, and I'm assuming it's going to be a joint presentation. Please proceed.
California has had an important legacy of protecting a woman's constitutional right to choose, and our state has a compelling interest to make sure that all pregnant women have timely access to health care when it comes to pregnancy-related services, whether it be prenatal care or abortion services. Unfortunately, in recent years, we've seen clinics that have often delayed that care with information that has falsely linked abortions to breast cancer, infertility, and mental illness. Delays that lead to complications, serious health outcomes, and low birth weight babies. For example, a recent study that you will likely hear about have shown that over 90% of so-called crisis pregnancy centers have provided such false information. I have in my hand some examples of brochures that have been handed out at crisis pregnancy centers, and let me just read from one of them. An abortion in the early months of pregnancy predisposes a woman to getting breast cancer. Possible long-term complications from abortions are miscarriages, premature deliveries, breast cancer, etc. This bill helps to address this delay so a woman receives timely and medically accurate care by requiring unlicensed facilities to provide a simple 2-line notice that a facility is unlicensed and that there are no licensed medical providers on staff, as well as by requiring licensed facilities to provide a simple 4-line notice that free or low-cost public programs are available for comprehensive family planning services, prenatal care, and abortion services with a phone number to the local county social service office. Since this bill has been mischaracterized, let me be clear about what AB 775 does not do. It doesn't require referrals to abortion clinics. It doesn't provide a preference to one clinic over another. It doesn't shut down any centers or prevent any centers from providing current ongoing services, and it doesn't discriminate on the basis of religion. This bill has been carefully crafted based on other laws upheld by the courts. I want to thank the health providers, women's organizations, religious groups who have supported this bill, as well as Attorney General Kamala Harris, whose office helped to draft the language that ensures that our bill is consistent with constitutional law. And with that, I'd like to turn it over to our joint author, Assemblymember Burke.
Thank you, Mr. Chair and Senators. For decades, California has guaranteed a woman's right to her own reproductive choices and access to a basic level of health care. But that right is an empty promise if she lacks the ability to obtain care and services, or if the provider she's trusting to care for her doesn't give her all of the information about all of her health care options. It's hard for me to understand how those who claim to care about women find it so threatening to inform them about accessible, affordable health care. Ensuring that all women have the care they need to lead healthy lives shouldn't be controversial. We should all be able to agree that women deserve to have accurate and complete information wherever they turn for care, especially when they are making some of the most important decisions that they will ever face. AB 775 does not require anyone to refer a patient to an abortion provider, nor does it tell anyone what to say during a counseling session. With this bill, all clinics will be held to the same standard, and all patients will have access to clear, timely information about their health care rights. That's it. We're just asking all providers, public and private, to respect our constitutional rights and trust that we can make our own choices when it comes to our own health care. Thank you.
Thank you. Before we proceed, just let me remind both the proponents as well as the opponents, we are allowing 3 individuals or a total of 6 minutes, 2 per individual, or if you choose to have one individual do all the 6 minutes, that's fine. We will be cutting you off after the 6-minute period. After that, whether you're support or opposition, that you only state your name and position, and you refrain from any remarks at that point. So with that, I'd like you to proceed. Thank you very much.
Good afternoon. My name is Amy Everett. I'm the state director at NARAD Pro-Choice California. We organize our over 70,000 supporters on behalf of to protect and expand reproductive freedom in our state. California has long stood as a leader of reproductive freedom. Many of the people in this room, in fact, have worked very tirelessly to pass laws to expand and protect that freedom. However, those laws are only meaningful if women actually know about them. Deciding if or when to have children is a time-sensitive decision, and women in California need to have comprehensive information to make that decision for themselves. That's what the Reproductive Fact Act provides. AB 775 is about creating a standard across licensed community and free clinics that serve millions of millions of low-income women. Under this bill, every woman who seeks services at a licensed reproductive facility can walk out knowing that the state of California can help pay for family planning, prenatal care, or abortion care. Money should not be a barrier to receiving the best medical care, and whether a woman chooses abortion, adoption, or parenting, she will know she can get the medical services that she needs. Some opponents of this bill claim that it is unreasonable to require this notification because these clinics are private entities. But the clinics have obtained a license from the state of California and therefore submit themselves to the rules and regulations of the state. The state has a compelling case for making sure women are informed about these services. And it is not just a lack of information that threatens women's reproductive freedom in California. Our state is home to more than 170 so-called crisis pregnancy centers, organizations that put their anti-choice agendas ahead of women's health. With false advertising that misleads women into thinking CPCs provide comprehensive women's health care, to the training offered by a CPC umbrella organization called Heartbeat International, which advises CPCs to have 2 websites, one for donors that talks about their anti-choice, anti-abortion mission, and one for potential customers or women seeking information that only talks about medical health. Many CPCs are unlicensed and run by volunteers who look like counselors. The Reproductive Fact Act will make sure that women know they are not meeting with an actual licensed medical provider. Unlicensed facilities must include this information in their advertising and their websites. We can all agree that women should have complete and accurate information when making these important decisions, and that is what AB 775 helps them do, and I urge your aye vote. Thank you.
Thank you. Next, please proceed.
My name is Dr. Sally Greenwald. I'm an OBGYN practicing at University of California, San Francisco, and I'm here to encourage you to support AB 775 because of my belief in timely access to care, both prenatal, abortion, and family planning. During the first trimester of pregnancy, prior to the 12th week, that is when the fetus is developing all of its organ systems, the heart, the brain, and the spine. Clearly, this is an important time period for medical providers to intervene. Clearly, early access is important during this time period. Additionally, for women who seek to terminate the pregnancy, the later they present in gestation, the more risky and the more costly termination of their pregnancy is. Therefore, regardless of what the woman chooses to do, it is important that she have access to early care. I have cared for a woman who has had diabetes who initially presented to a crisis pregnancy center, which resulted in delay of care to the appropriate provider. During the time when her fetus was developing inside of her, she had such high levels of sugar inside of her blood that the fetus was exposed to lifelong risks such as cardiac malformations, brain anomalies, spine deformations. Should she had presented to a place where she had access to more appropriate care, we could have lowered the sugar in her blood and she would have had better outcomes both for mom and for baby. I've also cared for women who have decided to terminate the pregnancy, and had they had information and access to more timely care, they would have been candidates to take a pill and terminate the pregnancy at home. However, because of delay in access to that information, they had to be admitted to the hospital, taken to sleep in an operating room in order to end their pregnancy. I'm passionate about early care for termination, for prenatal care, and for contraceptive services, and it is important that we support this bill so that women can have access to that information. Thank you.
Thank you. We do have a minute and 24 seconds remaining. We will hold to it. Please proceed.
Hi, thank you. Good afternoon. I'm Dr. Juliana Mello. I'm an obstetrician gynecologist practicing here in Sacramento at the University of California, Davis. I appreciate the opportunity to speak in support of the Reproductive Fact Act on behalf of the California women I serve. I feel fortunate to practice in California, a state that leads the country in legislation protecting women's reproductive freedom. I think an important aspect of this bill is the requirement that all unlicensed facilities providing pregnancy-related services clarify that they're not licensed by the state to provide medical care. I think this is really important because one of the most important aspects of my job is to provide women with accurate information so they can make educated healthcare decisions. I've often seen patients who were deceived by these unlicensed facilities to think that they were receiving care from a medical professional or to believe medically inaccurate information. I recently had a patient, we'll call her Sophia, 23 years old, single mother with an unplanned pregnancy who presented to a crisis pregnancy center seeking an abortion. She thought she was going to comprehensive women's health care based on an online advertisement, but only later realized it was not a medical facility. Not only was she delayed in obtaining the service she was seeking, she was also given medically inaccurate information about abortion. She was told it would increase her risk of breast cancer, infertility, mental health complications, claims which are all completely false. Once she presented to a medical center offering the full range of reproductive health care services, she received evidence-based counseling and was able to make an informed decision that was right for her. If she had known about the facility's unlicensed status, she would have never gone there. And this is just one of the many patients I've seen who have spent time in a place that they did not intend to go. Crisis pregnancy centers threaten the health of women by misleading them, delaying access to time-sensitive healthcare services and accurate information about these. I believe this bill will help empower California women with accurate information to make the best healthcare decisions for them and their families.
Thank you.
Thank you.
We're going to ask the remainder to just state their name and position at this time, and we did go over by about 30 seconds, so I'm going to allow the opponents to have the same exact amount of time. Please proceed.
Yes, sir. Chair and Member Sean South on behalf of the California Primary Care Association in support.
Thank you.
Randy Hicks with the California Secular Coalition in support.
Roxanne Gould, representing the American Nurses Association of California, in support.
Rebecca Griffin, in support.
Jason Chavok, in support.
Emily Gregg, in support.
Jean Iwi, retired healthcare manager, in support.
Sylvia Solis Shaw, on behalf of the City and County of San Francisco and the Office of Mayor Ed Lee, in support.
Christopher Castry on behalf of LA Mayor Eric Garcetti in support.
Robert Sumner on behalf of Attorney General Kamala Harris, co-sponsor.
Mitch Cronin, professor of OBGYN at UC Davis in support.
Dr. Melissa Chen at the University of California, Davis, in support.
Dr. Sarah Forrest, resident physician at the University of California, Davis, in support.
Olivia Nguyen, medical student at the University of California, Davis, in support.
Eileen Schnitger, Director of Public Policy, Women's Health Specialist of California, in support.
Carol Moon Goldberg of the League of Women Voters of California, in support.
Shireen Dada, Legal Monitor of Women's Health Specialists, in support.
Zori Whitaker, in support.
Shannon Smith Crowley, American Congress of Obstetricians and Gynecologists in California, in support.
Elaine Sierra, Nevada County Citizens for Choice, in support.
Lynn Wenzel, Co-President, Business and Professional Women of Nevada County, in support.
Gregory Kramer, Planned Parenthood Affiliates of California, representing over 115 clinics in support.
Nicole Wortelman, Alameda County Board of Supervisors in support.
Thank you. Those in opposition, if we can make some room up here, if you'd like to come up. As long as we can make some room for 3 microphones for the opposition, appreciate it. And then we Good afternoon. Please state your name and just give me a couple seconds because we got to get the timer started. Okay, please proceed. Thank you.
Thank you, Mr. Chairman and members. My name is Dr. Vanson Wong. I'm an OBGYN physician who's been working in the Sacramento area for 27 years with a large medical group here. My career has been devoted to the healthcare of women and specifically with reproductive choices. I performed hundreds of abortions and have counseled many more regarding their right to choose. I'm here today as the medical director of Alternatives Pregnancy Center. Alternatives Pregnancy Center is a faith-based, nonprofit, licensed community medical facility that receives no taxpayer dollars. We rely solely on donations from individuals and churches to provide all of our medical and social services free of charge. Authors of this bill have claimed that the notice is not a referral for abortion. However, let's examine this. This notice would be displayed in our waiting room saying, quote, California has public programs that provide immediate free or low-cost access to comprehensive family services, prenatal care, and abortion for eligible women. To determine whether you qualify, contact this county social services office at the following number. Black's Law Legal Dictionary defines refer as to, quote, to send or direct for treatment, information, service, or decision. AB 775 fits this legal definition of a referral like surgical gloves fit my hands. California citizens are well known for our diverse values and opinions about what we want from our healthcare providers. It is this diversity that and inclusion that makes our state a great place to live. Alternatives is an important part of this important diversity in the state of California. We respect the fact that everyone has the legal right to make reproductive health choices that are best for them, and we never judge anyone for their choices. Many of my patients have told me how they were talked into having an abortion that they later regretted. Assuring that every woman in California feels that she has an alternative to abortion is true diversity and inclusion. AB 775 will greatly harm alternatives and all that we stand for in our community because it forces us to disseminate a notice to our clients that may ultimately redirect them to an abortion clinic. This is a gross violation of our religious values and freedom of speech. Diversity matters in California. We implore you to vote no on AB 775.
Thank you. Anyone else in opposition?
Thank you for the opportunity to share with you my strong opposition of AB 775. My name is Blaine Wittig. I'm the Executive Director of Options for Women, a licensed medical facility in Concord. I've had 2 abortions. My first was at the age of 19 at a Planned Parenthood clinic while I was a student at San Francisco State. Planned Parenthood told me that the abortion was the best thing for me as I had my whole future ahead of me. I trusted them and I aborted my child. They did not provide me with any options. They did not provide me with adoption or encourage me to talk about my decision. They did not discuss anything other than abortion. They did not share any ways that I could stay in school and still have my child. A few years later, I went back to Planned Parenthood. At that time, I was in a committed relationship, and they still encouraged me to have an abortion. I experienced a devastating depression as a result of that abortion, and ultimately it led to long-term relationship issues. I'm still brokenhearted over the loss of our child through abortion. A few months later, my fiance and I were pregnant again, and I was extremely afraid of being pregnant, but my fear of abortion was greater. I could not go through another horrific abortion experience at Planned Parenthood. Thankfully, I chose life for my son. By the age of 25, I had completed my master's. I'm living proof that women are strong enough, capable enough, and smart enough to be mothers and successful women at the same time. I'm not alone in these experiences. nor are they rare. We see women at clinics who are suffering life-altering sadness as a result of aborting their child. Pregnancy centers and clinics exist to provide women the opportunity to fully talk through their choices and to make a plan that works best for them, including medical, personal, social, emotional, and financial needs. AB 775 would direct a woman away from our services before she even had the chance to see a nurse or a patient advocate. In our trial implementation of AB 775 for licensed medical clinics, when we called county social services, we were directed to Planned Parenthood, not a low-cost government agency, as the authors of the bill state. If those women go to Planned Parenthood, as I did, my experience tells me it's likely they won't be able to talk through their choices to make the best decision for them. They will be talked into making the best decision for the abortion clinic's bottom line. As I understand it, this committee is about assuring that quality healthcare services are available for all citizens of California. California is known for embracing diversity, yet it appears from this bill that that does not include diversity of thought. Our clinic's healthcare services and professionals are deeply rooted in Judeo-Christian values that all life matters, and our respect for the fact that everyone has the legal right to make reproductive health choices that they feel are best for them. I want to conclude my testimony by reminding you that diversity and inclusion matter to us in California, and AB 775 undermines these ideals. Please protect our right as a nonprofit, faith-based organization to serve women in our community with our core values. Vote no on AB 775.
Thank you. And we do have about 30 seconds left. If you'd like to proceed.
My name is Carol Dodds. I'm the Executive Director of A Woman's Friend Pregnancy Resource Clinic in Marysville. I oppose this bill along with all of the executive directors, board members, volunteers, staff, and many successful mothers and happy patients and clients. I'm here to answer any technical questions you might have.